So just going back to the point about talking to a bot or figuring out if an AI is telling us to do something or not, I want to pick up on one of your most cited pieces of work that was published back in 2021. Hopefully be able to explain a bit more to us, but you gave some pieces of advice to radiologists and you randomized to whether you told them this advice was AI generated or by a human and saw whether that made a difference to how they accepted that advice. Could you tell us a bit more about how you set up that study and what you found?
Yeah, absolutely. So that study started out when I first looked into AI-enabled decision support systems in healthcare. And I could only find tech papers that showed really promising algorithms to interpret medical images. And I asked around and how are the users, how do they interact with it? What happens? And everybody's like, nothing is implemented. It's just like the technology.
Yeah.
And it's not like it's just a model. It's not implemented in a clinical interface. It's like, oh, that's interesting, because coming as a psychologist, and immediately I thought this will have an impact on humans because it's not neutral and information influences us. And so the idea was really to understand, does this source of the information make a difference on how we accept this information? And what does this label of AI mean? And so we had exactly the same cases for our both expert participants, which were radiologists, because it was chest x-ray images that we gave them. And then we also had a group of internal medicine physicians that can clearly review x-rays but don't have as much training as a trained radiologist on that. And we gave them the same cases and we gave them the same type of advice that we manipulated if it came either from a human expert or from the AI. And we manipulated the accuracy of the advice. And we did see that independent of your expertise, task expertise, there was a strong reliance on the system overall, and even task experts followed incorrect advice, which was really shocking back then to the clinicians. And for me as a psychologist, it's like, of course it will influence you. The interesting part was, even though it was exactly the same advice, both the experts and non-experts interpreted the quality of the advice worse when it came from the AI in comparison to when we told them it came from a human, which in the end it was the same. So we think we did find some kind of algorithm aversion there, that we punish systems harsher or technology harsher when they fail. We run a second experiment where we tested exactly for that, where we only gave perfect and accurate advice. And there we didn't find that effect. So even, again, reliance was the same in both conditions. But in that case, if the system operates perfectly, we trusted the same as another human, or at least that's what we found. And what we also found there is we gave explanations. So we put bounding boxes around the findings on the images. And that really only helped the non-expert reviewers.
Right.
So that was also very interesting to see who, for instance, explainability is something that is really discussed within AI is helpful for. And it seems that it's predominantly helpful for non-task experts to make the decision, while it was not really helpful for the task experts per se.
So that's really interesting. So it seems like experts don't benefit as much as non-experts from AI. But when we implement AI tools for radiology in a hospital, we implement it across the board. So it's within our imaging systems and anyone can see it, potentially the emergency doctors and the radiologists. Do you think, given your research, that maybe we should withhold the AI from certain clinicians, depending on their expertise level, because we know it doesn't help them or might influence them in the wrong ways? Or does that just make things way too complicated? Or I guess I'm wondering what the practical implementation would be for that.
Yeah, so there's a strong discussion at the moment, especially in should we give trainees access to AI systems when they might not have acquired the full proficiency that we would like them. And there are now the first statements from medical bodies that do say there needs to be a certain level of expertise before we should allow trainees to have access to the systems. And then it's also the question, like, should, for instance, a non-task expert, like an emergency doctor that also does imaging, have access to that? But I would say yes, because they benefit the most from it. The question is just like, do we never acquire important skills and do we lose important skills? And there the question is really, I think, to a degree, an open question because there haven't been enough studies. What we already know for skill acquisition, if you give a system that has exactly the same task as you, if you give that to a learner, they will probably not really learn as deeply how to do that task, because then they just offload the task and never have this like effortful, deliberate engagement with the task that is really important for learning. However, if we develop a system that is actually helping you to question yourself, a system that is basically designed to learn, designed to make you reflect, might even provide you with hard cases where you struggle, then these systems can really amplify our learning. Most of this is not done within healthcare. A lot of this is done within learning science. But I think that already gives us some kind of indications of how can we implement that and for whom. But that's also the same for experts. So there's now the first kind of studies have been published that if you give task experts AI systems and have them operate with these systems and then take them out again, their task performance drops below their pre-AI baseline performance.